Hi, my name is Abigail, and this is my head, eyes, ears, nose, and throat assessment, and this is my UT student ID, and then doing a quick scan of the room. Okay, and so prior to starting this assessment, I washed my hands according to the hygiene and infection control guidelines, and so with that, hi, my name is Abigail, and I'll be your nurse for today. Can I have your name?
Kaylee.
Alright, Kaylee, what's your date of birth?
3/17/2000.
Thank you. So today, Kaylee, we're going to do your head, eyes, ears, nose, and throat assessment. Do you have any past or current medical issues in those areas?
I have acne on my face, and then I had an ear infection last week.
Have you been treated for those?
I used a topical prescription for my acne, and then I was prescribed antibiotics for the ear infection.
Awesome, thank you, Kaylee. So to start Kaylee's assessment, we're going to do the head exam. So if you sit up straight for me and look at me. Okay, so Kaylee's head appears to be normal cephalic, and her face appears to be oval in shape. It's disproportional to her body and midline to her body. And so now we're going to assess her face when it's at rest and moving. And so at rest, her face appears to be symmetrical. And so, Kaylee, can you smile for me? And then can you frown? And puff your cheeks out? And raise your eyebrows. Alright, and so during movement, Kaylee's face also appears to be symmetrical. And so going on from the head, we're going to start with the skin. So can you turn your face this way? And then that way. And so look at Kaylee's skin, it appears to be pale in color with a red undertone, and I don't see any signs of acne, and so the topical medication she's taking appears to be working, and I also don't see any signs of any freckles or scars or anything like that on her face. And so next from skin, we're going to go to her hair. Can you tilt your head down? And so Kaylee's hair appears to be evenly distributed, brown in color and clean. And so we're going to do a scalp assessment next. And so during the scalp assessment, we're looking for lesions or parasites. And so Kaylee, can you tip your head down? Can I touch your hair?
Yeah.
And so we're going to look at specifically behind the ears and at the base of the neck and just sifting through to feel for any lesions or parasites. And I don't see any, so we're all good there, Kaylee. And so after the hair, we're going to do an eyes assessment. So can you pull down your lower eyelids, please? Thank you. And so look at Kaylee's sclera. It appears to be white in color with minimal red veins, and her conjunctiva appears to be transparent and moist with no drainage, and her iris appears to be green. Thank you, Kaylee. And so after that, we're going to start a series of eye exams. Alrighty, and so we're going to use pen light for the light reflex test. And so it's going to be bright, Kaylee. And so we're going to go about 12 inches from the bridge of her nose. And we're checking to see if the light reflects in the same spot on her eyes, which it does. And the next exam is the position exam. So Kaylee, can you look at the pen light and follow it with your eyes and no head movement? Alright, good. So her eyes follow it smoothly, both at the same time. And next we're going to do the cover test. And so Kaylee, can you use this and can you cover your right eye? Perfect, thank you. And then can you remove it? And then cover your left eye, and then remove it. Alright, and her eyes appear to have fixation there, so that's good. And then next we're going to do the Perla test, and so that's pupils equal, round, reflective to light, and accommodation. And so I have a ruler on my pen light, and so I'm going to look and see if they're equal and reflective, or equal and round. Kaylee, can you look at me? Alrighty, so her pupils appear to be equal and round. And the next we're going to check to see if they're reflective to light. So it's going to be bright again, Kaylee. We're going to shine it in her right eye. Ready? Look at me. And that is constrictive, which is good. And then her left eye, which also appears to be constrictive, and both eyes constrict at the same time, which is good. Thank you, Kaylee. And then finally, we're going to do the accommodation test. And so, Kaylee, follow this with your eyes. We're going to push it towards her nose, and back, and towards and back, and her eyes follow that smoothly as well, which is all good. So that's good for the eye exams. And next we're going to do the ear exams. And so we're going to check to see, we're going to look at her auricles, helix, and tragus and see if there's any irritation or redness, which I don't see any. It appears to be the same color as your skin, pale with red undertones. And then can I look in your ear? I don't see any drainage in Kaylee's ear, which means the antibiotics that she took for ear infection must be working pretty well. And so next we're going to palpate her ears to see if there's any tenderness. Kaylee, can I check your ears?
Yes.
Alright, so we're going to palpate the auricles, and the helix, and the tragus. Any pain there, Kaylee?
No.
And we're also going to make sure to palpate the mastoid process behind your ears. Does that hurt, Kaylee?
No.
Awesome, thank you. So her ears appears to be all good. And so next we're going to do the nose assessment, and looking at her nose, it appears to sit midline to her face, which is good. So using my pen light again, I'm going to check the inside of her nose to make sure that looks all clear. Can you tip your head back? So looking at the inside of Kaylee's nose, it appears to be pale pink in color with no drainage or runniness and no signs of inflammation, which is good. Alrighty, and we're also going to check her sinuses to make sure there's no tenderness or pain there. Can I touch your face? So let me know if you feel any pain. Any pain there, Kaylee?
No.
No? Alrighty. So that's good for the nose exam. And then we're also going to start the mouth exam. So looking at Kaylee's mouth, her lips appear to be pink in color and moist with no cracking or drainage. And so using the pen light again, we're going to see if, we're going to check the inside of her mouth. So I'm going to put gloves on for that. Alrighty. So using gloves, and this to hold down her tongue and the pen light. Great, Kaylee, can you open your mouth for me and say ah? So when Kaylee goes ah, her uvula moves up, which is good. And can you lift your tongue? Alrighty. Don't see any abnormalities under her tongue. And then, oh, I'm sorry. Can you open your mouth? And then we're going to go ah again. Alrighty. And looking at the back of her throat, I don't see any signs of inflammation or irritation, and her tonsils appear to be all good too. And then looking at her teeth and buccal mucosa, I don't see any signs of bite marks or anything like that, and her teeth appear to be pearly white, so that's good. Alrighty. And then finally, we're going to do Kaylee's neck exam. So looking at Kaylee's neck, I don't see any kind of swelling or irritation, and so we're going to palpate Kaylee's neck. Can I touch your neck, Kaylee? Yes. Alright, let me know if you feel anything or any pain or anything. No, no pain in the neck?
No.
Alrighty. And so we're also going to check for TMJ. Have you had any kind of TMJ issues in the past?
No.
No? Alrighty. So can I touch your face?
Yeah.
So we're going to feel for the TMJ, and then can you open and close your mouth? Alrighty. And then move the jaw side to side. Alrighty. So here's the, do you have any pain there, Kaylee?
No.
No? So it appears that Kaylee's TMJ and jaw have full range of motion. No signs of swelling or tenderness there. And so you appear to be all good, Kaylee, and that concludes our HEENT exam.